Hi, Bill Yannick here, your Connect CEO with today's episode of the Daily Grind. I think we're into our third or fourth or fifth week, but who's counting? It's hard to keep the days straight, but we're here every day for you at 1 Central, the same link, same time. And we've been talking every day about COVID-19 and dealing with this pandemic and epidemics. And we have a great guest I'll introduce in a moment, but real quick for review, the format of this Daily Grind is every day at 1 Central. We try to limit it to 5 or so minutes. We bring in expert guests from across the FM landscape. And in this case today, we have a guest from one of our partner associations or a group that we deal with a lot called ASHRAE. It's the American Society of Heating and Refrigeration Engineers. I think I said that right. And today we have Dr. Stephanie Taylor with us from Vermont. Welcome, Dr. Taylor.
Good afternoon.
Dr. Taylor, talk about an expert. She's part of the ASHRAE Epidemic Task Force. And as I introduced ASHRAE, if I know in our built environment groups, we've heard of ASHRAE before. They do a whole bunch of things across the landscape of the built environment. But Dr. Taylor, you are on their Epidemic Task Force. And so actually, before we get into that, why don't we just do a quick introduction of who you are, what your firm does, and then we'll dig into the task force work that you're doing for ASHRAE.
Okay, great. So I'm a physician, primarily a pediatric oncologist. Graduated from Harvard Med School from Boston, and I do my clinical work in Boston. And some decades ago, I became concerned about the number of infections that my patients were getting in the hospital. And so I had some concern that the building may be playing a role in these infections. But as a physician, when I tried to talk with the facility managers, you know, they didn't really understand me, and frankly, I didn't understand them. So eventually I went back and got my master's in architecture and engineering so I could really understand buildings better. Fast forward from that point in time, I began to do research looking at patient outcomes in conjunction with the building, in conjunction with the hospital. And to my great surprise, we began to see data that showed that one of the most powerful drivers of patient infections was low relative humidity indoors. So I was skeptical at first because I was totally surprised, but just because I didn't expect it doesn't mean it wasn't true. And we began to see this trend in all building types. So that's a little bit about my background. Eventually I became connected with ASHRAE, and I'm very impressed by the breadth of their knowledge base and their guidelines. So that's a short history of me.
Neat stuff. And yeah, what a time for an intersection between the built environment and health. I mean, and normally it might be more of a comfort thing. And now, unfortunately, we're talking sometimes life or death. But, and Stephanie, I know in our membership, we have a huge segment of our membership are HVAC companies. And one of the things we deal with is, you know, how pure the air is, how clean the air is, and what the relative humidity in that area is. And behind you there, you've got the RH, and you're talking to a recovering attorney here. So I had to ask Stephanie off camera what the heck that meant, but she's got relative humidity between 40 and 60%. And what are your thoughts on, so if you were talking to our HVAC companies and consulting with them, dealing on all sorts of built environments, of course, yeah, we have some medical facilities that are part of our membership, but we also have high traffic retail facilities. What are some of your thoughts on that, dealing with HVAC in the built environment?
So Bill, I mean, ironically, this pandemic is a very frightening thing, but it's also an opportunity for us to begin to really understand how important the indoor environment is in protecting our health. And what we're finding right now, one management step that we can take that's very beneficial to people is humidify your indoor environments. We all should be running humidification systems, whether it's a humidifier that you buy at your local pharmacy or you get a full building installation done. We should be managing our indoor environments to keep the relative humidity between 40 and 60%. And the reasons for this are threefold. One, when you keep your humidity in that range, if somebody who is sick with COVID-19 comes into your home or office or school, hospital, and coughs or sneezes or even breathes, they're going to release small aerosols into the air that are highly infectious. And these tiny aerosols quickly shrink. And the drier the air is in your building, the more rapidly and the more thoroughly they shrink. And once they become these very tiny droplet nuclei, they can pass through the airspace, they can pass from one room to another. And when they reach another human being and they're inhaled, they become rehydrated and are still highly infectious. So keeping the humidity between 40 and 60% decreases the burden of airborne infectious aerosols. Number two, in the case of this virus, for some reason that we don't fully understand, it is actually less infectious in a mid-range relative humidity zone of 40 to 60%. And then thirdly, we now know the mechanisms by which this degree of relative humidity actually optimizes our respiratory immune system. So when you're in dry air, your respiratory natural defense mechanisms don't work as well. Whereas in 50%, they're all optimized. So these are three reasons that humidifying your indoor space is a very clear and actionable step we can all be taking right now.
It's a little counterintuitive coming from a layman. When you think about it, you would think dry air. I think dry air, cleaner, that you don't have viruses, but it's almost the opposite is what you're.
Well, actually, it's very much the opposite. And the whole theory about hygiene and about clean is kind of been turned upside down, because we now know that as human beings, we live with a huge number of bacteria and viruses that are actually beneficial to our health. So when we dry out the air, first of all, we don't clean it. But secondly, we're actually selecting for the more dangerous pathogens. So that's a lot to get into in a 5-minute story, but dry air is really not good for people, and the pathogens love it.
Fascinating stuff. That's so maybe as we end up here, and we're going to have some certainly resources at our coronavirus section on connectsfm.com. Personally, how are you dealing with, so you're working from home like a lot of us, you mentioned off camera a little bit that you travel a lot. So how are you getting along in this shelter in place environment?
Well, so luckily I have an office a couple miles down the road in Vermont. And given that I'm in public health and medicine, I'm allowed as a quote unquote essential person to come to my office. Otherwise, my husband and I would probably have strangled each other by now. He's a great guy, but this is an adjustment. So I am incredibly busy with ASHRAE and with healthcare facilities, offices, trying to help manage the indoor environment right now, and also to help buildings prepare for when we do reoccupy them. How are we going to reassure people that we're taking their health and their concerns seriously? So I'm very busy.
Yes, and I'll end on this. You mentioned some of the silver linings in a very difficult situation that all of us who've dealt with built environment issues at times, it's hard to get the ear of policymakers and decision makers. And I have a feeling that we're going to have their ear for some time, especially when dealing with something as serious as this, when you're talking life or death. But Dr. Stephanie Taylor, it's been great. Thank you so much for your time. I look forward to meeting you in person sometime soon, or maybe have you back on the daily grind when we're talking about the other side of this, hopefully in 90 or so days and the economy's back up and running, and we talk about how to go past this pandemic. But thanks again for your time. And for our audience out there, thank you for attending today's Daily Grind. 1 Central every day, same link, same time, and we'll talk to you tomorrow. Have a great day.